Have you ever had your heart skip a beat? Anxiety when you notice in the toilet. White foam floating on the surface. Urine every time you walk in. Toilet? My name is Dr. Sergey Nikolaevich. I am 76 years old and have been for 40 years. I work as a general practitioner, specializing in diseases. Kidney during this time, I met thousands. Patients, but what is happening now gives me particular concern. Patient, whom I saw just a month ago before, still stands before my eyes. There was a 62-year-old man who came to hospital just because of few. I noticed foam in my urine for days in a row. When I saw his tests, was truly amazed. Protein level in. Urine exceeded the norm by more than 10. Once, kidney function was already reduced by about 30%, and still in my ears. His words sound. At first I thought that I just didn't drink enough water. Even imagine. I couldn't think it was so serious. Dear friends, regular viewers, channel Strength of Spirit. If you don't watch it, this video is up to the end. You may miss it. The most important golden time for music, kidney recovery. If you think that foaming urine is just the consequence of not drinking enough, is a very dangerous misconception. If you look at the statistics, then it turns out that more than 80% of people whose urine is constantly foaming already, kidney damage began. And fortunately, after 40 years of working with thousands, I noticed one amazing patient pattern. Regular music watermelon, which we love so much in the summer heat, shows a striking effect in supporting kidney health, especially strong effect, as I was convinced of. Practice renders a substance called citrulline, which is in large quantity contained in the rind of a watermelon. It improves blood circulation in the kidneys and helps the body eliminate more actively products of exchange. Perhaps for some it's all. This will seem like a fairy tale. So right away, I will say these are not theories from books, but observations that I have repeatedly tested it on my patients. The same one, the 62-year-old man I talked about beginning in just 6 months thanks to complex of nutritional and lifestyle changes. Life, which included watermelon, reduced the level. Protein in urine more than doubled. His kidney function improved by approximately 20%. Today I want to reveal to you everything that I know. We'll talk about the real reasons, the appearance of foam in the urine, how to support your kidneys with the right food, including watermelon, and about how to keep your kidneys healthy for a long time, years. I will share my experience and knowledge, which I collected for 40 years, nothing concealing. So I ask you to listen carefully and without haste until the end. Should you ignore the foam you see on the toilet every morning? Majority people I've met over the years, practitioners, say approximately the same thing. Well, a little foam, age is no longer the same. It's not scary. We just need more. Drink water and everything will pass. And so, attitude is the most insidious trap, which slowly but surely destroys your kidneys. And no matter how often I repeated this increasingly even will. Few. So I'll say it again, foaming. Urine is very often the last signal, alarm given by your kidneys. A little foam may appear even in normal urine if the stream falls from height or you are emptying too quickly. Large bladders may foam and disappear quickly. Fine. The problem starts then. When fine, dense foam lasts a long time on the surface of the water, even after flushing, like a sticky hat. If such foam lasts more than 3 days in a row, this may mean that through the kidneys already, protein leaks out. At the end of 2019, come to me, a patient came that I can't never forget. A 58-year-old woman came just because the daughter is literally forced her to make an appointment. Her urine has been foaming for over a year now. She herself thought it was nothing when I saw her tests. Everything is inside me. It got colder. Lost through urine within 24 hours. More than 5 g of protein. Normally no more than 0.15. Grama. Music. It was even worse. See that the size of the kidneys on ultrasound is narrower, decreased by approximately 30%. Shrinking kidneys means that the damage is already irreversible. Then this one, the woman asked me, is it really 1 by 1? Fine, you can guess that everything is so. Running. And here there is a very important technique. Self-diagnosis, which you are obliged to do. No, the first sign of persistent foam after morning urination, after the first morning trip to the toilet. Wait about 10 minutes and watch. Into the toilet. If the foam still sticks to surface of the water and does not disappear. This warning sign. The second sign is the nature of the foam itself. If the foam is fine, dense, multi-layered, similar to thick soap cap, this needs to be taken into account very seriously. And here I want tell you another amazing one. Fact, many people don't even suspect that. Foaming urine is essentially a cry for the help that our kidneys send us. This, like a smoke alarm in case of fire. Apartment, if you turn it off and pretend that nothing is happening, one day you may face trouble, which can no longer be corrected. Friends, do you know how scary? The way the kidneys are destroyed? I will share the most frightening truth that I realized after observing many patients. Kidney damage develops as falling dominoes. First it all begins. Only foam in the urine. Next stage, swelling appears in the ankle area. In the morning you may notice a puffy face and swollen eyelids. At the third stage, shortness of breath and chronic fatigue. Climb the stairs in total. 1 or 2 flights and you are suffocating, but really scary. Starts from the fourth stage. From this moment, toxins begin to accumulate in body. Appetite appears. Constant nausea. In severe cases, the person may even lose consciousness. If the process has reached its final stage, the only thing left is dialysis, permanent blood purification through a device, or kidney transplant. I'll tell you a story. Another patient whom I met in mid-2017. It was a man, 65 years. The first time he came to hospital, said, just urine, foams a little. During examination, it turned out that kidney function was already reduced by more than 50%, but he didn't take it seriously. Through 6 months, he was brought to intensive care for ambulance. The whole body was so swollen that he was unrecognizable. Lungs were filled with liquid, and he no longer could breathe normally. His words that, "They're still squeezing my chest. Doctor, I really didn't know anything, even. I couldn't imagine that because of some foam it will come to this. Just so that, to prevent such a situation, there is danger signals that you can check now. The first signal is traces of elastic from socks. If in the evening, taking off your socks, you see a deep mark from rubber bands, and my ankles seem swollen, this may be the beginning of swelling. Second, signal morning face. If in the morning, looking in the mirror, you notice that your eyelids and the face looks more swollen than, usually be extra careful. The third signal is a change in urine. If the volume of urine has noticeably decreased or the color became much darker and concentrated than before, you need consult a doctor immediately. But even on, you can't give up at this stage. This is also, it's not too late. Something I've seen many times on practice for 40 years. If there is a problem, detect in early stages function. Kidneys can be partially restored and quite significantly. And the main one, the tool here is proper nutrition and lifestyle change. Among all ways, especially Bright Effect shows a method based on eating watermelon. Many perceive watermelon is only a summer treat, but In fact, he can become real, an ally for your kidneys. To those who, first time hearing that watermelon is healthy, music for the kidneys, it may seem strange. I myself at first treated. I'm skeptical about this idea. Everything has changed. Around mid-2015, when they brought me an elderly woman, 69 years old. Brought by granddaughter. Grandmother complained that for several days her urine foams and the ankles swell. Analyzes showed very high levels of protein in urine and a sharp decrease in kidney function. We started standard treatment, but the condition, it hardly improved. And now a month later, Grandma came again and the results, just amazed. Urine protein level dropped by more than half. When I asked what she was doing, the answer was unexpected. My granddaughter rubbed it every day. Watermelon with rind and puree, and Grandma. I drank 3 large glasses of this. Drink per day. At first I thought that this is a coincidence, but curiosity did not give. I have peace, music, and I have studied in detail. Composition of watermelon. That's when I came across to an amazing fact, the key to support. Kidneys turned out to be citrulline, an amino acid contained in watermelon. Getting into body, citrulline is converted into arginine, and arginine dilates blood vessels, including kidney vessels, improving blood flow. The effect resembles a cleaning. Clogged pipe. The blood is starting to get better, circulate, and are easier for the kidneys to filter harmful substances. Another important one, moment, citrulline in watermelon rind, about twice as much as in Makodi. Most people throw away the crust without even suspecting what exactly is hidden there. Main resource, but the most important thing is correct way to use. If eat watermelon haphazardly with the desired effect, you may not notice. First rule, watermelon is best eaten on an empty stomach. If you eat him after a heavy meal, he mixed with other food and nutrients are less absorbed. The second rule is moderation. The optimal daily portion is approximately from 300 to 500 g. Too large quantity, on the contrary, can create extra stress on the kidneys. Third rule, use a crust. If possible, it is better to chop the watermelon together within. Green crust in a blender or grate. At first the taste may seem unusual, but if you add a little honey or lemon juice drink, it will be much more enjoyable. The most effective time in the morning on an empty stomach and approximately 2 hours after dinner. In these periods, the body absorbs best. Citrulline, even one watermelon can give noticeable kidney support. But what I have seen it many times in my practice with combining watermelon with some other fruits, the effect is greatly enhanced. Once, maybe someone will find my words. May seem like a fairy tale, but those who saw these changes on themselves, they themselves were surprised. How much can it change? State of the body. First fruit? Which I want to say is an apple. The pectin contained in apples helps bind and remove from the body toxins, including heavy salts, metals, and drug residues. At regular consumption of apples, as if being washed from the inside. Late 2018, a 72-year-old man came to see me. His kidney function was seriously reduced due to years of taking medications for high blood pressure. I recommended he should eat 1 apple every day, distributing it into several doses, and consume watermelon at the same time. Already in several weeks function indicators. Kidneys improved by about 20%. The next assistant is cranberry. Proanthocyanidins found in cranberries reduce inflammation in the urinary tract and help prevent infections. Urinary tract. 1 glass cranberry juice or diluted juice per day already provides significant support. Kidneys and bladder. And one more. An important fruit is the cherry. Anthocyanins, which give it a rich color, protect kidney cells from damage, and support recovery processes. 2. Cherries also contain melatonin, which helps normalize sleep. Therefore, it is especially useful to eat it during afternoon or evening. You simultaneously support your kidneys and improve the quality of your night's rest. How? How to combine all these fruits. Method, which I recommend to my patients. Looks like this: a glass in the morning on an empty stomach, watermelon drink or a serving of watermelon toward the middle of the day as a snack, 1 apple divided into several small pieces after dinner glass, cranberry juice or diluted juice in the evening, a few cherries. Thus, good for the kidneys. Substances enter the body evenly throughout the day, creating like this, called a synergistic effect when an orchestra of different components sounds together, but there are important ones here. Warning. Firstly, for diabetes, the amount of fruit is strictly necessary. Control. The total weight of fruit per day should not exceed approximately 200 g, and the level blood sugar is needed regularly. Check. Secondly, if kidney function already greatly reduced, definitely needed, monitor the level of potassium in the blood. Fruits contain a lot of potassium, and if the kidneys are not cope with its elimination, excess potassium may become dangerous. In such cases, any changes in diet are necessary. Agree with your doctor. And one more thing, one important rule: no fruits, not enough, if you really want to support and, as far as possible, restore kidneys. Lifestyle will have to change comprehensively. This is a very important part, and no matter how many times I repeat this, it's always not enough. So I ask you, make the most of it attentively. The first thing to change is habits. Drink water. Most people only drink when he feels thirsty. This fundamentally wrong approach. The kidneys are an organ that works 24 hours a day. They're like an engine in a factory, which constantly needs lubrication. Without enough fluid, kidneys are working hard. Method that I recommend this. Immediately after, when you wake up, drink a full glass of warm water. The water temperature should be close to body temperature, approximately from 36 to 37 degrees. Water that is too cold can become stress for blood vessels and kidneys. Then drink half a day during the day. Glasses of water every 30 to 40 minutes in small portions. Optimal daily amount of water, about 30 milliliters per 1 kilogram of body weight. For a person weighing 60 kilograms is approximately 1.8 L per day. But the main thing here is not a flood yourself in large quantities at once, and drink little by little but often. Next important step, reducing salt. Salt is the main enemy of the kidneys because it increases blood pressure and increases the load on the kidney filters. But you can't suddenly remove salt either. Make food almost fresh in 1 day, the body will experience stress. The method I recommend to patients is gradual decline. In the first week, reduce the amount of salt to about 80% from the usual. On the second, up to 60%. On the third, up to 40% of the initial level. This way the body has time to adapt without unnecessary discomfort. Protein in the diet also needs to be regulated. Many heard that protein is healthy and started eating too much of it, but excess protein turns into an additional burden for the kidneys because all products, they are forced to remove protein breakdown. The optimal amount is about 0.8 g protein per 1 kilogram of body weight per day. For a person weighing 60 kilograms is an average of 45 to 50 g protein. This is, for example, about 2 eggs a day plus some cottage cheese or a small portion of fish or meat. It is important not to eat everything at once, but distribute protein over 3 meals. Many people underestimate the influence physical activity and sleep kidneys. They think that sports are only for losing weight and sleep just so as not to get tired. But with this approach, return, kidney health will not work. Influence, physical activity on the kidneys. Amazing. I'll tell you an example of a patient whom I met at the end of 2020. There was a 64-year-old woman, which has a function. Kidneys have greatly decreased due to complications. Diabetes mellitus when she first came to me. It was difficult for her to get up, even on one floor. Appeared immediately. Severe shortness of breath. Legs were very swollen. I offered her the simplest option, daily walking for 30 minutes. At first, it was difficult for her to walk even 5 minutes, but she didn't give up, and every day a little. Increased the time. After 2 months, when she came for a follow-up appointment, the results surprised me. Kidney function improved by about 30%. Why is this happening? Because moderate physical activity accelerates circulation. The kidneys are the organ through which passes through the entire volume of our blood. How? The better the blood circulates, the better the kidneys receive oxygen and nutrients, substances, and the more effective they are working. But even here it is important not overdo. If the kidneys are weakened and suddenly start doing heavy stuff, sports can only make things worse. State, moderate aerobic exercise is optimal. Loads, fast walking, riding, cycling, swimming. The landmark is very simple. If during load you can still talk to the person nearby, the intensity is appropriate. If you're so out of breath that you can't anymore, say, it's too hard, you need to slow down. If, on the contrary, you are too easy, just increase the speed or duration of the walk. No less, sleep is also important. During sleep, all organs are undergoing recovery, and the kidneys are not exception. From approximately 2,200 hours before 2 a.m., the kidneys are most active, are engaged in self-repair. At this time, you should already be sleeping deeply and calmly. Sleep. It is better not to drink 2 hours before bedtime. A lot of liquid. If you are constantly wake up at night to go to toilet, depth and quality of sleep dramatically fall, and this hits the whole body. Another rule, don't look in bed, TV, and don't scroll through your smartphone. Bright. The screen and the flow of information excite the brain and make it difficult to sleep. If you say now to myself, I'll do a little, then somehow I will continue, there's a risk that you will not get to real recovery. So please listen to the end. Now I will tell you about the changes that I saw it in real people, which observed personally, because dry words and theories are not always convincing, but real ones. History. Yes, it was a hot summer. 2021. A man came into my office, 67 years with his wife. He came almost under pressure from relatives. For several days now his urine has been very foams, but he kept putting off going to the doctor. Typical male stubbornness. Nothing. The terrible thing will pass on its own. Analyzes that we received were shocking. Per day, about 8 g of protein were excreted in the urine. This more than 50 times higher than the upper one. Normal limit. Kidney function has decreased to approximately 40% of normal. Pressure jumped to 180. And at the same time he spoke. Me, doctor, is it really that serious? Nothing hurts me. This is where problem. Kidney disease often occurs, almost asymptomatic, and people sincerely, they think that everything is fine with them. I invited this man to implement everything. Recommendations about today. Told, watermelon drink in the morning, 300 milliliters. 1 apple during the day, divided into several meals. Cranberry juice during the day, several in the evening. Cherry berries. At the same time, water control. Salt, protein, moderate walking, and normalization of sleep. First 2 weeks, there were almost no changes. Music himself. The patient also doubted. His look, as if he was saying, "Is all this really? Will it really help?" But from the 3rd week, they started music, noticeable changes. The first thing that changed was appearance of urine. Previously, there was foam, dense and pronounced, but gradually, the urine became increasingly clear. In the 4th week, the amount of foam decreased by more than half, and by the 6th, for a week, she was almost invisible. In 8 weeks, we repeated the tests. Results: it was hard to believe at first. Protein levels decreased from 8 to 2 GMO per day, an improvement of approximately 75%. Kidney function rose from 40% to 65%. The pressure stabilized around 140 at 90. But what struck me most was not this, but a change in the person himself. When he first arrived, his gait was hard, tired face, look extinguished. After 2 months, it was different. Human, light gait, lively look, healthy glow. I remember his wife's words. "Still, doctor, thank you. I have, like a new husband. Now every morning first of all, he looks for his fruits and not cigarettes or coffee." Over 40 years of observations, I realized one thing about the patients. Kidneys, this is a priceless organ that cannot be. Stop music fight. Many, they resign themselves. They say, since they are old, to be sick. It's normal, but it's wrong. Belief, the reason why despite his years still, I'm working and feeling energetic, is that I don't consider illnesses to be normal. Old age, all the recommendations that I give to patients. First of all, I apply it to myself. Every morning I start day with a glass of watermelon drink or portions of watermelon. During the day I eat an apple, and in the evening I love, treat yourself to a few berries, cherries. But the main thing that saves my kidney function is at a good level even after 70 years. It's not the product themselves, but constancy. A miracle does not happen in 1 to 2 days. It takes at least a few weeks so that the body begins to respond. And now, I'll summarize everything in a simple step-by-step manner. Diagram you can start right away. Today is the first week. Add 2. There's only one change in your life. Morning watermelon drink for an empty stomach, 300 milliliters. In the 2nd week, connect. Apple, distributing it throughout the day. On 3rd week, add cranberry juice. After lunch. In the 4th week, top it off with a few cherries. In the evening, change your water drinking habit too. Gradually. First get to at least 1 liters a day, then carefully increase to the appropriate volume. Your weight and condition as recommended. Doctor, reduce salt slowly over a week. For a week, to make it easier for the body. Adapt with physical activity. Start with the smallest things. Let it be. There will be 10 minutes of leisurely walking a day. It may seem difficult at first, but if you don't give up and add literally 5 minutes every a few days in a month, you can walk comfortably for 30 minutes. The most important thing is not to stop there. Halfway, a lot of people quit after week without seeing immediate results. But our body changes slowly, especially the kidneys, an organ that recovers not in days, but in weeks and months. That's why patience is so important. If along the way you have doubts or anxiety, don't withdraw into yourself. Get tested, pass. Tests, consult your doctor so you can see the real ones. Changes and adjust in time. Path, the kidneys are worth it. Take care every day.